There are quite a lot of drugs here that patients are taking. And as you said, that there are over 750,000 prescriptions per year given throughout the health system. And a substantial amount of these 750,000 are for patients with diabetes and hypertension. And successive governments have paid a lot of interest on the non-communicable diseases for diabetes and hypertension and cancer and so on. I think it is imperative for us to know when you're going to be taking off these drugs, what are you replacing them with, and how you're going to continue to educate the patient and deal with the patient population, because patients are extremely worried and concerned. And it is very unfortunate. I remember my colleague, Dr. Pet Manning, raising this issue when, unfortunately, our former Prime Minister passed away as a result of what she considered to be an inefficacious drug. And it was whether warfarin was causing the anticoagulation that was necessary in his case. And you would remember that as well. So people are frightened. They're extremely worried. And I think it is incumbent upon you as Honorable Minister and the government to tell the population what it is that you intend to do and what comfort can you give to them, particularly when their lives are threatened. Madam Speaker.
Minister of Health.
Thank you, Madam Speaker, as I respond to my colleague from Caroni East. Madam Speaker, I answered an urgent question today, which was headlined in the newspaper, words to the effect, Venezuelan dies after being denied health care at Eric Williams. And on reading that headline, one would get the impression that this person presented and was refused health care. And I was able to demonstrate today that the article was completely false, that the patient did in fact get health care and discharge himself against medical advice. When I made the statement, the following day, a newspaper ran a front page headline, CDAP drugs not good, and that is what caused the panic. 3 doctors who saw me that night making my contribution, on reading the Express the following morning, called me in shock and horror and saying, Terence, we heard what you said last night, and we are reading the newspaper this morning, and it is completely different. Nowhere did I say, and I repeated it again, that CDAP drugs are not good. I did not say insulin is not good. I did not say NSAIDs are not good. I did not say any of the other drugs are not good. But like the story about the Venezuelan being denied health care, this is what was published on the front page of the Express, over which I have absolutely no control. And I am a defender of a free press, and I encourage the media to be free and unfettered. But these 2 examples, I think, bring to the fore that we need to be, all of us, need to be a little more responsible in how we report on matters pertaining to health. What I did say was that we are looking at 2 particular categories, 2 particular drugs for diabetes and hypertension. Let me go back a little bit. So I dealt with what the media has portrayed this to be, and I have no problems with that. At no time again did I say any drug was unsafe. There's a big difference. The drugs are safe. I am on simvastatin from India for years, and my cholesterol levels are perfect. So at no time did I make a blanket statement that generics from India are not good. They have very good generics, but like in anything else, you have good and you have the not so good. Whether it's from India, the United States, wherever, and that applies to pharmaceuticals. And I was clear on that, absolutely clear. What we are doing now, which hasn't been done in a while, The CDAP program is a creation of the People's National Movement. I don't know if it was Minister Imbert who did it at that time. 2003?
Yes, it was.
Good. And it's an excellent program and needs to be supported. However, what was supposed to happen with CDAP over the years, Honorable Member, and you may not know this, Member for Barataria Sanwan will know, and Minister Imbert will know. There was supposed to be a 3-year cyclical review of CDAP. That hasn't been done in recent times, and we are now doing that. Because it is this government's position that healthcare must be of a certain quality. In doing all of that, we are again relooking at the national formulary and developing prescribing protocols for the major categories. This formulary exercise, the reformulation of the formulary, no pun intended, is a joint project between the Ministry of Health, PAHO, and the Trinidad and Tobago Medical Association, where experts in the field will come together and develop their prescribing protocols. We are tackling, in the first instance, HIV/AIDS, and then we are tackling also oncology. And the third category of drugs we are tackling are metabolic diseases, especially diabetes, also hypertension. The specific drugs that we are looking at are the 1 or 2 of the oral drugs for diabetes and hypertension. That's all. That's all. That's all. And we are going to replace them. And those instructions have gone out to NIBDEC for this year's procurement cycle. What the doctors are doing in the interim, as you know, they are titrating the doses of these 2 drugs according to the clinical symptoms being presented by the patient. So no patient is a danger. Absolutely no patient is a danger. They may have to take a little more, and that's about it. Just to bring it up to bioequivalency. And we are moving very fast, and I give you the assurance. And I think the motion you have raised is a very good motion, because this matter needs to be explained, because I think the newspaper headline did not do what I said justice. And let me give you another example. In that same contribution on May the 11th, I actually praised the member for Barataria Sanwan for starting up the HPV vaccine drive. And there was a headline in the Newsday speaking about one case where a mother reported to the media in her own words what happened to her daughter after taking the HPV vaccine. And when you read the headline, but read the article, the headline tarnished that HPV vaccine drive. And you know what is the backlash now, Honorable Member? Because of a misplaced newspaper headline, people are now shying away from accessing a safe and effective vaccine that could save lives. And I commended the member for Barataria Sanwan on that initiative. But I have to defend the program. It's a good program. But very often, the way these stories are carried in the media, we cannot deal with the backlash. Because even if there's a retraction, the retraction is not on page 1 with a screaming headline. The retraction is going to be buried on page 5 or 6. Right? And I have no control. So I want to thank you for raising this, but I want to reassure the national community that the doctors I have spoken to have even thanked me for raising the issue. Because what I have been having the fortitude to talk about in the Parliament is something they have been asking for a while. It is limited to 2 drugs, just for oral, has nothing to do with insulin, has nothing to do with the other 50 or 60 drugs on CDAP. I want to make that abundantly clear, because the Express headline was a total misrepresentation of what I said. The Express headline was, CDAP drugs not good. That was a blanket statement, just like the news, they had a blanket front page statement about the HPV vaccines. And when we do that, we scare the population, and now they are not going to seek the vaccines. So we have to be careful in the public domain how we report on things pertaining to health. And I have the clear example today again of the Venezuelan national, where the newspaper said he was denied treatment. And I have the factual matrix to show that. So I'm urging all of us, media, ourselves, to be a little more responsible in how we discuss matters of health. Thank you very much, Madam Speaker.